So if you look into craniomaxillofacial surgery, you see 3D printing is one part of it. So it all starts with starting with imaging and segmentation. It's come down to the design of the implants or the anatomical models or your medical devices. You could also integrate different kind of technologies into the planning like robotics and laser. You could optimize your planning workflows with AI diagnostics. Different kind of biomaterials come into these pictures, and in the end is more like patient-reported outcomes, which we need to keep a track of or be aware of to at least know where we are going. Is it the right way or not? Coming on to this computational diagnostic, one visualization, it's also what we are working together with our Department of Biomedical Engineering. So it's a spectromedical, it's a virtual rendering software. So you could see the clear anatomy or even the diseases in a very clear way here. Another workflow which I really like personally is virtual reality. So segmentation in these kind of platforms, they really are very quick and very intuitive. And sometimes it's very difficult to segment the soft tissues or the vessels, and which using these kind of workflows or the software plans really streamlines our current workflows. Onto the bioresorbable area, we are working on, it's a research project actually. So we are trying to see the potential of these kind of materials in different applications. And one example that I could clearly show you, it's a typical scenario in children where the normal growth of the skull is not there. And then to reconstruct or bring the skull in a symmetrical form, you need to make these cuts into the skull. And here we try to implement, like, instead of using a surgical guide, you could also use a robotic surgery appliance over here. So the robot would cut the skull according to our preoperative plan, and these fixations can be easily materialized with 3D printed implants. So on one hand, you don't have to print your surgical guides and you don't have to pre-bend your plates. So this is something like a comparative study that we did on simulation models, where we evaluated what we could results we could achieve with the standard workflow, which is with surgical guides, and compared it with our laser osteotomy and reconstruction with PSI. And we could clearly see here, like, the fabrication accuracy of 3D printed implants was really high. And on the overall reconstruction, we were still under 2 millimeter deviation. So still a scope of improvement, I would say, but we would be getting there.